Estradiol is a hormone, estrogen, that is used by women to help reduce symptoms of menopause, such as hot flashes and vaginal dryness. These symptoms occur when the body produces less estrogen. It can also be used to prevent bone loss after menopause. There are other medications that can also prevent bone loss and may be safer, so they should be considered before using estradiol. Estradiol can also be used to treat certain types of prostate cancer and breast cancer that has spread to other parts of the body. It is also used by women who are not able to produce enough estrogen due to conditions like hypogonadism or primary ovarian failure. If you are using this medication to treat symptoms only in and around the vagina, products applied directly inside the vagina should be considered before medications that are taken by mouth, absorbed through the skin, or injected. As for the daily dosage and timing, it is best to follow the instructions of your doctor or pharmacist. Before you start taking estradiol, make sure to read the patient information leaflet provided by your pharmacist. If you have any questions, don't hesitate to ask your doctor or pharmacist. Take this medication by mouth as directed by your doctor, with or without food. You can also take it with food or right after a meal to prevent stomach upset. If you are using the extended-release tablets, make sure not to crush, chew, or dissolve them as this can lead to increased side effects. Swallow the tablets whole. The dosage of estradiol is determined based on your medical condition and how you respond to the treatment. It's important to take this medication regularly to get the most benefit from it. To help you remember, take it at the same times each day as directed by your doctor. Make sure to follow your dosing schedule carefully and do not increase your dose or take this medication more often or for a longer time than directed. If your condition does not improve or worsens, make sure to inform your doctor. Some common side effects of estradiol include stomach upset, nausea/vomiting, bloating, breast tenderness, headache, or weight changes. If you notice any of these effects lasting or getting worse, be sure to contact your doctor or pharmacist. Additionally, if you see the tablet in your stool, it's important to tell your doctor promptly. Remember, this medication has been prescribed to you because your doctor believes that the benefits outweigh the potential side effects. Many people using this medication do not experience serious side effects. However, it's important to contact your doctor right away if you experience any serious side effects, such as persistent nausea/vomiting, mental/mood changes, breast lumps, unusual vaginal bleeding, severe stomach/abdominal pain, or swelling in the hands/ankles/feet. In rare cases, estradiol may cause serious problems from blood clots, such as heart attacks, strokes, or pulmonary embolism. If you experience symptoms such as chest/jaw/left arm pain, sudden/severe headache, weakness on one side of the body, trouble speaking, or trouble breathing, seek medical help immediately. While very rare, if you notice symptoms of a serious allergic reaction, such as rash, swelling of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help right away. This is not a complete list of possible side effects, so if you notice any other effects, be sure to contact your doctor or pharmacist. If you are in the US, you can report side effects to the FDA at 1-800-FDA-1088, and in Canada, you can report them to Health Canada at 1-866-234-2345. Estrogens, whether used alone or with another hormone, can have some serious side effects. It's important to talk to your doctor about the risks and benefits of hormone treatment. Estrogens should not be used to prevent heart disease or dementia. Using estrogens can increase the risk of uterine cancer. Taking a progestin as directed by your doctor can help decrease this risk. If you experience any unusual vaginal bleeding, be sure to tell your doctor right away. In postmenopausal women, using estrogens, with or without a progestin, can increase the risk of breast/ovarian cancer, stroke, dementia, and serious blood clots. When used with a progestin, estrogens also increase the risk of heart disease. The risk of serious side effects may depend on the dose of estrogen and how long it is used. This medication should be used at the lowest effective dose and for the shortest amount of time. It's important to discuss the use of this medication with your doctor and have regular checkups, for example, every 3 to 6 months, to see if you still need to take this medication. If you will be taking this medication long-term, you should have regular complete physical exams, for example, once a year, as directed by your doctor. Before starting estradiol, it's important to talk to your doctor or pharmacist if you have any allergies or if you have a history of certain medical conditions. This includes conditions such as vaginal bleeding of unknown cause, certain cancers, blood clots, stroke, heart disease, liver disease, kidney disease, high blood pressure, diabetes, high cholesterol, and more. It's also important to avoid smoking while taking this medication, as it can increase the risk of serious health issues. If you are planning to have surgery or will be immobile for an extended period, be sure to discuss this with your doctor as well. Additionally, using sunscreen and protective clothing when outdoors is important, as estradiol can cause dark spots on the skin. If you wear contact lenses, it's important to monitor any vision problems that may arise while taking this medication. If you are pregnant or breastfeeding, it's important to consult with your doctor before using estradiol. When taking estradiol, it's important to be aware of potential drug interactions which could affect how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Avoid starting, stopping, or changing the dosage of any medicines without your doctor's approval. There are some products that may interact with estradiol, including aromatase inhibitors, fezolinetant, fulvestrant, aspemifene, raloxifene, tamoxifen, toremifene, and tranexamic acid. Additionally, estradiol may interfere with certain lab tests, such as the metirapone test, possibly causing false test results. It's important to inform lab personnel and all your doctors that you are using this medication. As for the optimal usage of estradiol, the daily dosage and best time to take it should be determined by your doctor based on your individual needs and medical condition. Be sure to follow your doctor's instructions carefully. If you or someone else has taken too much estradiol and are experiencing severe symptoms such as passing out or difficulty breathing, it's important to seek immediate medical help by calling 911 or a poison control center. In the U.S., you can reach your local poison control center at 1-800-222-1222. Canadian residents should call their provincial poison control center. Symptoms of an overdose may include severe nausea or vomiting, as well as unusual vaginal bleeding. Remember, do not share this medication with others. It's important to have regular physical exams and medical tests while taking estradiol to monitor your health. This includes blood pressure checks, breast exams, mammograms, pelvic exams, and pap smears. It's crucial to follow your doctor's instructions for examining your breasts and report any lumps right away. Make sure to keep all medical and lab appointments and consult your doctor for more details. Taking estradiol can help prevent or control high blood pressure, high cholesterol, and diabetes, which can reduce your chances of heart disease and stroke. Lifestyle changes like reducing stress, eating a low-fat/salt diet, losing weight if overweight, exercising regularly, and stopping smoking can also be beneficial. Additionally, keeping your mind active with mental exercises like reading and solving crossword puzzles can help prevent dementia. Talk to your doctor about lifestyle changes that might benefit you. If you're experiencing hot flashes, lifestyle changes like stopping smoking, dressing lightly or in layers, avoiding spicy foods, caffeine, and alcohol, reducing stress, and exercising regularly may help reduce symptoms. To promote healthy bones, consider increasing weight-bearing exercise, stopping smoking, limiting alcohol, and eating well-balanced meals with adequate calcium and vitamin D. You may also need to take calcium and vitamin D supplements, so consult your doctor for specific advice. If you forget to take a dose of estradiol, take it as soon as you remember. If it's almost time for your next dose, just skip the missed dose and take your next dose at the usual time. Don't take a double dose to make up for the missed one. It's important to store estradiol at room temperature, away from light and moisture. Avoid storing it in the bathroom and make sure to keep it out of reach of children and pets. When it comes to disposing of estradiol, do not flush it down the toilet or pour it into a drain unless instructed to do so. Properly discard this product and it is expired or no longer needed. If you have any questions about how to dispose of estradiol, consult your pharmacist or local waste disposal company. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.